Namaskar. Today we have Dr. Priya Ganesh Kumar with us. Dr. Priya Ganesh Kumar is working in the field of gynecology from last around 30 years, and she's also working in the field of preventive oncology from last around 20 years. She is the medical director of Sainiwas Healthcare. She's working in the field of cervical cancer, and I must tell you one thing about her, that she has saved more than 35,000 uterus. Dr. Priya Ganesh Kumar is today she's talking on the subject of cervical cancer, and cervical cancer is a big threat to women in this particular era. We are just talking about cervical cancer. Ma'am, आपका स्वागत है. You are welcome in Thane वर्तमान.
Thank you very much, Nitin, and thank you, audience.
I was talking to madam regarding this cervical cancer, and I'm really, it's a horrible numbers what she has told me. And please tell me what is the पूरी व्याप्ति क्या है cervical cancer की? Please tell us.
So now, cervical cancer is a disease that's a cancer of the cervicus uteri, the mouth of the cancer, mouth of the uterus, you can say. So in our country, around 79,000 deaths are occurring due to cervical cancer in a year. In a day, you'll be surprised, 200 women are dying due to cervical cancer. Every 8 minutes, a lady loses her life due to cervical cancer in our country. And globally, we are in the number 2 position after China for the deaths related to cervical cancer.
Oh, this is a very alarming situation, I think, because every 8 to 10 minutes we are losing a woman in India due to cervical cancer. Ma'am, tell me, what are the क्या लक्षण होते हैं?
Okay, so the symptoms for cervical cancers can be excessive white discharge or postcoital bleeding, intramenstrual bleeding, postmenopausal bleeding. These are all the symptoms, but there is some very special thing about cervical cancer, because prior to cervical cancer, we have a full prodromal phase of 15 years. Where the cells are becoming abnormal, they are called pre-cancer. And so you'll be again surprised, 50% of the time there are no symptoms.
Correct.
A patient will not know that she has a cervical cancer.
Right.
So that's the horrible thing.
Yeah.
And the cancer is caused because of a virus, which is called human papilloma virus.
Actually, so now we are very much useful to the word virus, and madam, when the word virus comes, simultaneously vaccination comes. Okay,
Yeah.
so tell me what vaccines are available for HPV?
Yeah, so let me brief you a little bit about human papilloma virus. So again, this is a strong figure that in our country, out of 5, 4 ladies would have this virus sometime or the other in their lifetime.
Such a big number.
Yeah, but then every virus doesn't go into a cancer. When we talk about a human papilloma virus, is also the causative factor for, or one of the causative factors for oropharyngeal cancer,
Right.
penile cancer, anal
Right.
cancer.
Right.
So now this virus, since it is a virus, you rightly said there is vaccine for it.
Right.
And this vaccine is called as HPV vaccine. It has to be given for girls from 9 to 14 years of age in 2 doses 6 months apart. Now suppose if you miss the bus for some time or the other, you haven't given to your girl,
Right.
and she has become like older than 14, so from 15 years to 45 years this lady can take, and that time you give 3 doses. So HPV is human papilloma virus. It has got around 150 strains, and out of these strains there are low risk and high risk. In our country, out of 5, 4 are having HPV, but that doesn't mean that each and every goes into a cancer, because a virus has got its own short time. Within a year, this virus will become negative if you have a good resistance power.
Okay.
Immunity power.
Right.
So So that's the reason that there are, since it's a virus, we do have a vaccine.
Right.
Now
right.
for girls from 9 to 14 years, even a boy can take it.
Right.
Okay, so two doses, 6 months apart. And from the age of 15 to 45, if suppose a girl hasn't taken during this period, she can very well take it now from 15 years to 45 years of age with 3 doses.
Okay.
Yeah.
So even if you have missed this vaccination, you can take this vaccination up to 45 years, and believe me, it is very very important to take it. So it is very important to take a vaccination. Madam, screening is a next step
Yes.
for cervical cancer.
Yes.
Tell me something about screening.
Absolutely.
Hmm.
So now, since I told you that 50% of the time a lady will not have any symptoms, so how do you protect yourself? So it's very pertinent that a lady from the age of 30 years onwards till 65 years or 60 years can get herself screened. Rather than can, I will say must get herself screened every 5 years with HPV tests. There are also tests called PAP test which is available, or a VIA test which is available. So WHO has said that even if a lady can do twice screening in the lifetime, at 35 years and 45 years with HPV test, we come to know whether there is an HPV in the cervix or not, and if that is detected, so the next step for that would be to get a colposcopy.
Exactly. And what is the recommendation of WHO?
Now WHO has said that world free of cervical cancer by 2030 is the slogan, which was said in 2020.
Barabar.
And the slogan is 90-70-90, that is 90% vaccination of the girls,
Right.
70% of screening for women in that
Right.
population. And when you screen, we come to know pre-cancer or cancer, right?
Correct.
Then treatment of that, 90% of them getting treated. If that is systematically followed in any country, in any province, then there will be a time when we can say that this area has become cervical cancer free. That means less than 4 per 1 lakh population
Right.
suffering for cervical cancer any given point of time.
Okay.
That is their goal.
Okay. So now I am telling you some figures. Dr. Priya Ganesh Kumar has screened more than 48,000 ladies for cervical cancer, and the next number is much more important because this number has really bring changes in life of women as well as their families, because more than 35,000 women's uterus she has saved, and she has also saved their lives. Madam, this is a big number.
Yeah, we could achieve it because see, as a WHO teacher for this colposcopy, and I have my books into medical colleges. So far we have trained more than 2,000 gynecologists.
Right.
Now what happened is these gynecologists are then further taken up, they take up our healthcare. They come into our healthcare.
Right.
So in this manner, now today we have in our Sainiwas healthcare around 60, it's a chain of 60 colposcopy centers pan India.
Right.
Out which by the collective efforts we have screened almost 1.5 lakh women. Out of that, when we found that there are certain risky things, they go for colposcopy. So 48,000 ladies has gone, out of that has gone into colposcopy. And then when we have detected certain precancerous conditions, we then treat it. So our main motto of Sainiwas Healthcare is Save Uterus. So by treating these precancerous conditions, around 35,000 ladies we would have treated with thermal ablations, leap therapies, which are daycare procedures, OPD based procedures, which doesn't require anesthesia, which doesn't require admission, and that the uterus is saved because of that.
Exactly. And one more achievement of Madam is that she has screened more than 3,000 ladies in a day in a tribal district of Thane district, and 60 doctors of her have helped her in this particular achievement. And tell us something about this.
So this was in 2018 at we had selected Neral, the Adivasi village of Neral, and it was on May 30th. Yeah, I remember very correctly. And my whole team had come down. We had already 3,000 ladies were enrolled with us, and it was a little 2 or 3 days program. But on one particular day, the first day was a big bang. It was a big hit. 1,500 ladies had come down, and 15,000, sorry, 1,500, 1,500 ladies had been screened with all my colleagues together. We found around 800 ladies out of these being having precancerous conditions. Now those 800 people are then invited. They are being then brought every month to our hospital at Thane. We bear all their expenses, their travel, their food and all that. Then we treat them with colposcopy and the procedures. And so now I'm very happy to share with you all that whole area has become cervical cancer free.
Okay, very good. That's a big achievement. And Madam is medical director of Sainiwas Healthcare. She has got a state-of-art hospital in Thane city itself, and there she is practicing her gynecology department. And Madam, tell us something about Sainiwas Healthcare, as well as she is working in the field of infertility also. Tell us something about that.
So Sainiwas Hospital was established in 2005.
Okay.
It's a unit of Sainiwas Healthcare. Now, the healthcare has got 2 branches. One is at Thane, one is at Delhi as well.
Right.
And in this hospital, we are having a state-of-art operation theatre. We are doing a lot of laparoscopy work. We are our work in infertility is also much proclaimed. We get candidates, we get patients from far and wide. About, even as I am a gynecologist myself, so maternity again is one of the major things over here. So we deal with all high risk pregnancies. And the USP of this hospital, which is world famous, this center, is because of our state of art advanced colposcopy center. We started this center way back in 2005.
Right.
And it was first time in Thane district, rather I would say a state of art center which is being started.
Right.
And the treatments are also advanced treatment, and it's a research based treatment also, so we get plenty of cases also from pan world globally. Also we do have a clinic for PCOD. Nowadays PCOS is really increasing. So adolescents, menopausal age groups, we have menopausal clinics, we have PCOD clinics. Also we have obesity clinic. Nowadays obesity again is very high. So in that way we have been working as a complete package for women, from comprehensive package from prevention to cure.
So that's it from Dr. Priya Ganesh Kumar. Ma'am, thank you talking to us. So that was Dr. Priya Ganesh Kumar, and Madam, it was very enriching experience talking to you, and thank you very much.
Thank you very much.